All right, we are about to dive into a condition that honestly sounds like it's straight out of a medical thriller. It's one where your own body, your own defense system, actually becomes the enemy. It's called Guillain-Barré syndrome, and it's this rare but pretty serious disorder that can literally flip your world upside down in just a few days. So let's break down exactly what this is and why it's so important to understand. So just imagine this for a second. You get over a pretty standard bug, right? A cold, maybe a little stomach thing. You feel fine, you're back on your feet. But then, a week or two later, you feel this weird tingling in your toes, and it doesn't go away. In fact, it starts to spread. And before you know it, you're having trouble even standing up. This isn't some made-up scenario. It's the scary reality for people who get Guillain-Barré syndrome. So how does something like this happen? This rapid, really mysterious paralysis? The sheer speed is what makes GBS so incredibly frightening. Let's walk through the typical timeline of what someone goes through. Okay, this timeline really shows how quickly things can escalate. It almost always kicks off with some kind of infection that you wouldn't think twice about. Then, maybe 10 days later, the first real signs show up, that tingling and weakness, usually starting in the feet and hands. And from there, the weakness can just race up your body, hitting its absolute worst point within 2 to 4 weeks. That peak, doctors call it the nadir. That's the most dangerous part, before the very long road to recovery can even begin. So what are doctors actually looking for? Well, the textbook sign is weakness that's pretty much the same on both sides of the body, starting in the legs and moving up. But here's the real telltale clue, the loss of reflexes. You know, when a doctor taps your knee with that little hammer and nothing happens at all? That is a huge red flag for GBS. On top of that, you get that tingling feeling in a stocking glove pattern, and sometimes even your face can get weak. But the most dangerous part? That's when it messes with your automatic body functions, things like your blood pressure and heart rate, which can go completely haywire. So we've seen what happens, but the billion-dollar question is why? And this brings us to the culprit, a bizarre and frankly tragic case of friendly fire from our very own immune system. The whole problem boils down to this really fascinating idea called molecular mimicry. It's basically a case of mistaken identity. See, your immune system makes these amazing little soldiers antibodies to go fight an infection. But after the battle is won, these soldiers can get confused. They're still on high alert, and they might see a part of your own nerve cell that looks just a little bit like the enemy they just defeated. And so, they attack. They start attacking you. So let's break down that attack. It often starts with a super common bacteria, Campylobacter jejuni. You can get it from undercooked chicken. Your body, doing its job, makes antibodies to fight it. But then, things go wrong. Those antibodies mistakenly target the myelin sheath, which is like the protective insulation around your nerves. And when that insulation gets damaged, the nerve signals can't get through. It's like a short circuit. And that's what causes the paralysis. So, with this confusing, fast-moving picture, how on earth do doctors put all the pieces together? Let's take a look at how they solve this really critical neurological puzzle. You know, before they bring out any of the high-tech tests, the diagnosis really starts with some good old-fashioned detective work. It's all about listening to the patient's story, hearing about that recent sickness, and then doing a really thorough physical exam. The second a doctor hears about that weakness moving up the body and confirms those missing reflexes, Guillain-Barré syndrome shoots right to the top of their list. But to really confirm it, the key test is a spinal tap. Doctors analyze the fluid that surrounds your brain and spinal cord, and they're looking for a very specific, kind of weird clue, a super high level of protein, but a totally normal white blood cell count. This unique combo has a fancy name, albumin-cytologic dissociation, but it basically tells doctors that there's damage happening to the nerves, but there's no actual infection in the spinal fluid itself. It's like finding smoke without the fire. Okay, so once the diagnosis is confirmed, everything shifts to treatment. And with GBS, it is an absolute race against time to support the patient and stop the immune system's attack. The absolute #1 priority isn't some magic pill. It's just really, really careful supportive care. This is a true neurological emergency, and the single biggest danger is that the paralysis climbs so high it reaches the diaphragm, the main muscle you use to breathe. Somewhere around a quarter of all patients end up needing a ventilator to breathe for them, so being watched like a hawk in an ICU is absolutely critical. And to make that huge life or death decision about when to put someone on a ventilator, doctors have this clever little guide called the 20-30-40 rule. It's all about measuring lung capacity and breathing pressures. If the patient's numbers drop below certain thresholds, like if their lung capacity is less than 20 milliliters per kilogram, that's a huge warning sign that their breathing muscles are about to fail, and it's time to step in. Now, while we can't instantly undo the nerve damage, there are two really powerful treatments that can stop the attack and shorten the illness. First is IVIG, where they infuse a bunch of healthy antibodies to basically distract and overwhelm the patient's confused immune system. The other option is plasmapheresis, which is a process that literally filters the bad attacking antibodies right out of the person's blood. And the amazing thing is they both work equally well at getting patients on the road to recovery faster. Now listen up, because this next part is so important, and it's what makes GBS different from a lot of other autoimmune diseases. Steroids do not work. Your first thought might be, it's inflammation, let's hit it with corticosteroids. But in GBS, that's a big no-no. They've been shown to not help and might even cause harm. It's a critical point to remember. So after the storm of that initial acute phase finally passes, and with all the right treatment and support, the body can begin its slow, long process of healing. So let's look at that final chapter, the path to recovery. I'm not going to lie, the road to recovery can be incredibly long and difficult. It often takes months and months of intense physical therapy. But, and this is a big but, the long-term outlook is actually surprisingly good. As you can see here, the vast majority, over 80% of people, are walking independently within a year. Now, some people are left with lasting weakness, and sadly there is a small mortality rate, but overall, with the right care, the prognosis is quite hopeful. So if you take away just one thing from all of this, let it be this. Guillain-Barré syndrome is absolutely terrifying, but it is a treatable neurological emergency. The absolute key to getting a good outcome is catching those early signs of weakness that's moving and getting to a hospital right away. With this disease, every single hour matters. GBS is just such a powerful, stark reminder of the incredible complexity of our own immune systems. It really shows you that razor-thin line between protection and self-destruction. And as we get better and better at understanding this friendly fire, it's not only going to help GBS patients, but it could unlock new ways to treat all kinds of autoimmune diseases. It really leaves you wondering, doesn't it? What does this tell us about the future? It's a testament to how resilient we are and how far medicine has come. Thanks for tuning in.